Been a lot of controversy over the past few weeks over the tax on food, Blair's idea to tax on junk food. Food poverty seems to be a problem in this country, but also we've got an obesity crisis as well. You can't have both, surely.
We're in such a mess over obesity in this country. We know that 2/3 of UK adults are overweight or obese. We know that the NHS is spending £6.5 billion a year on obesity, and yet we still can't have a grown-up conversation about it. We still can't say to people, you're fat, you need to lose weight. And that sounds horrible, that sounds really unsympathetic, I know that. But I think that people are, well, firstly, they're walking towards an early grave. You know, obesity causes, it's the second biggest cause of cancer in this country after smoking. With smoking, we've been realistic. We've been grown up. We've said we need a ban on smoking. Smoking kills. We need to be able to talk to people sympathetically but supportively but honestly about obesity, about the fact that it causes heart attack, stroke, cancer, diabetes, you know, amputation, all of this stuff. The NHS is on its knees. We keep hearing the NHS is on its knees, COVID, another difficult winter coming up. Well, obesity is one of the biggest costs to the NHS. Doctors and patients need to be able to talk about this stuff and to talk about, are they overeating? Are they not able to exercise? What are the risks? What are the costs? Why are they not able to address the obesity crisis?
So, Simon, obesity, massive problem in this country, costs our NHS absolutely billions and billions of pounds. As Emma quite rightly says, it costs lives. You know, back in the day when I was at school and when you were at school, we didn't have fat kids. And I'm not scared to say that. We probably had one kid in the whole year that was overweight, and that kid normally lived with their grandma and they got spoiled. And but everybody else was fit. We did the PE, we ate properly, we had proper meals at home. Why are we scared to talk about this these days, Simon?
I'm not sure. I admire Emma's honesty around the issue, and I think we do need a more honest conversation with the public around these issues. I don't think we should tax junk food and unhealthy food, but I do think we should regulate it better. I think government can regulate processed food more, but ultimately we need to have a conversation with the public about what's healthy and what isn't. We can't just keep eating processed food, junk food. It's the cost associated with it as well. Processed food's expensive. I shop on the market. You buy stuff off the market for a fraction of the price and then cook it properly. You can have a healthy meal. So I think we have to have a more honest conversation about the whole issue.
People have lost those skills, haven't they, over the years, to be able to cook a nutritious meal?
They have, and it is about skills as well. But junk food is cheap. The stuff that is nutritionally empty, right? Salt, fat, sugar. You can buy, I've done this test, you can go around a supermarket, you can buy hundreds and hundreds and hundreds of calories for a couple of quid. You can buy those 6-10 packs of crisps for a couple of pounds. So it is easy to buy junk food and to do that. What I think, rather than taxing junk food and making poor people pay more in miserable, difficult, tough lives, what about incentivising healthy food? What about making the organic, lovely, fresh fruit and veg that the posh people buy? What about making that cheaper? Government can do things. People are having a difficult time of it.
But you say that, Emma, if they did that, if they incentivised people to buy organic food and made it cheaper, would the people that we're targeting actually go out and buy that?
Well, I think people know what's healthy and what's not. I think there's a myth that, poorer people don't know what is making them fat. I think they do. But we also have to address the fact that kids don't play out anymore. When we were little, we were outdoors the whole time. Yeah. Winter and summer, we were playing outside. Now children are inside. Most children are sitting inside in their bedrooms on their phones, not moving. They're staring at screens, they're staring at tablets. There's just everything. It's an obesogenic society. Go to the airport. What's the first thing you do? Go to a cafe. Then you move to a restaurant. Then you go to a bar. Then you get on the plane and they offer you snacks. All people are doing is eating, and then in between that, they're having snacks. Is it any wonder that people are getting obese?
So how come then, Simon? How come the left get away with saying on a daily basis that we've got a food poverty crisis in this country?
Yeah, well, I think there's a whole issue about the diet and that people face, the use, and I think that needs to be addressed. It's all about education. That's the reality of it. It's about educating people to be able to have a healthy lifestyle. Because, as Emma suggests, people are aware of these facts, but it's not hitting home for whatever reason, and perhaps it's more has to be done through education. to get people to understand what is healthy and what isn't. But there's also this issue about not being able to address it directly, not being able to say people are overweight and all the rest of it. I think we need a much more honest conversation, which is what you were suggesting.
And also talking to the government, and you guys are the politicians, talking to the food manufacturers and making them reduce salt, fat and sugar. They have got it, this perfect balance, salt, fat and sugar. You go and eat at McDonald's, half an hour later you're hungry. It doesn't satiate, it's not real food, it's empty food. It's addictive. It's as addictive as heroin, salt, fat and sugar at this level. You need to bring that down. They've brought down levels of salt and sodium in ready meals gradually over the years. People haven't noticed. Yeah. We don't need those shockingly high levels. Is it any wonder that children, when you're a fat child, you become a fat adult? It's very, very hard if you are overweight as a child. And I think 4/5 of our primary school and secondary school children, I know about disordered eating. I know what people are going to get. Oh, you're skinny, it's all right for you. No, I understand. I had anorexia for 10 years. I understand about people eating for comfort, about people having, psychological issues around food, because that's what it's also about. But we need to have an honest conversation about it.
You just mentioned anorexia there, Emma, and I recently went to see a young lady in hospital in my patch who's... she's actually down now to about 4 stone.
It's desperately sad.
She's 21, 22-year-old, beautiful lady.
Yeah.
A mother, you can imagine a mother and a family absolutely in bits. And we're trying to get her the best help. She's in the best place. Yeah. But it's that mental illness, I think. She thinks she's going to get fat if she has a spoonful of food, and it's absolutely heartbreaking. It is. You see, and that's what we should be getting.
Of course, and actually, I mean, it's a slightly separate issue, but treatment, NHS treatment, mental health treatment for eating disorders is another big scandal of our time. And people being treated locally with their families nearby.
Because of the obesity crisis, we're spending billions of pounds on obesity, which should be relatively easy to sort out.
Which is preventable, yeah.
Preventable, the anorexia, which is a proper mental illness.
They look very differently, but they're not that different, OK? There's a lot of mental addiction going on with food addiction, in the same way that when I was ill with anorexia, it was this terrible fear of eating. So, yeah, they are very different ends of the spectrum, but people with obesity are also in need of support and in need of psychological help in terms of... I
guess that's true, because...
Not using food as a crutch, not using it as your...
I've been to the diabetic clinic with a family member and the wife, and the first thing you see is people there with feet missing, with legs missing, and I'm going to be honest, they're all overweight, they're all pretty huge, and a bit of you thinks, as human beings, well, why have you got that big? But like Emma says, it is a mental illness as well if you keep eating food all the time, and that, Simon, as we said before, is putting enormous pressure on the NHS.
Yeah, no, absolutely right. And we've just been through a pandemic where people have been sort of locked down for a considerable amount of time. That hasn't helped the situation. We've come out of that. People are working from home more. We seem to be going in the wrong direction rather than the right direction.
More and more sedentary lives. People literally not even moving from their desk, from their computer all day long.
I guess that's a good point, that, because, back in the day, when I left school, I worked in a concrete factory, then down the pit for many, many years. Men especially had physical jobs. The women did as well. They worked in the factories.
But even washing the clothes, it was a physical labour of housework, cleaning the house. Now we've got hoovers, we've got this, we've got cleaners, we've got...
Walking to school.
Walking to school, being outdoors. So I think people have always enjoyed their food, and that's a wonderful thing, but they were burning it off. Now...
It's a good point, walking to school. We used to walk back from school, run back from school, and getting chased by the local feral dog, which was normally on the list. But it's all different. Then go out playing all night, playing football, playing cricket, or whatever. But we could talk about this all night, guys.